hundreds of villages and towns in the south of the Central African Republic are empty of people. Since fighting erupted in 2017, over 60,000 refugees have fled the violence that destroyed their villages by crossing the Bangi River to find safety in the Democratic Republic of the Congo. Their old villages in CAR are now only a 10-minute canoe ride away, but they can't go back home. These refugees are being hosted by already impoverished Congolese villages. Humanitarian needs are enormous, and pregnant women and infants are among the most vulnerable. Travelling with a team from Australia for UNHCR, Penny Jones and Reshma Joseph from Teachers Health have come to this remote corner of the DRC. They've come to see the work that UNHCR, the United Nations Refugee Agency, is doing in the area.
Started off the day, it was very exciting. I was certainly looking forward to this for many months. Didn't quite know what to expect.
Little huts thatched with mud brick. Older kids looking after little kids and all just playing by the roadside.
Teachers Health have recently begun a 3-year partnership with Australia for UNHCR to support maternal and neonatal care in the DRC. Penny and Reshma want to see the tangible impact of the partnership for themselves, as well as to determine what more needs to be done.
We then moved on to the Inke refugee camp, which was not what I expected at all. It was quite lovely, well laid out. There were little huts everywhere.
In Inke refugee camp, around 1/3 of the population are refugees. The local health facilities that UNHCR support are for both refugees and the local population.
UNHCR is supporting facilities both for the refugee population as well as the local community, which is it's a lovely byproduct of the activities of UNHCR in the region.
And as we drove in, there was a congregation of people and I wasn't quite sure what was going on.
The whole community, or what seemed like the whole community, was there. Welcoming us with various songs and dances.
And I loved the way that they were using the tools that they understood and knew, like song and dance, expressive dance, just to talk about all the challenges that the community faced there, the refugees.
And what we learnt was that these were socialisation activities, letting people know that if they get sick, they should come to the health facility. There was consult rooms, there was pharmacy, the maternity ward, which was really lovely. There was people who had literally just given birth. I mean, it's not nearly what we would be used to in the Western world, but a nice room, clean beds, clean sheet, clean facility. It certainly looked very clean and very comfortable for these ladies, it's very good.
The health centre that we went to, it had a lovely lady doctor managing the facility, and she took us for a tour around the place.
It's really great to see the difference we have made. The staff that we have helped fund, improve the training for birth attendants, providing much needed equipment like humic cribs, which are critical in the first hours of a baby's life, and the overall improvement of equipment at this centre.
The highlight of the day for me was when a mother let me carry their newborn, and it was beautiful.
Teachers Health also helped provide 7 rooms for consultations, anti-malarial treatment, iron supplements and the mosquito nets. The health centre has 400 patients and 8 births a week, but only has intermittent electricity. They're hoping to get solar panels soon.
We went into a hall where all the women were singing and clapping and dancing, and they made us dance too. That was a lot of fun for me. I felt like we were welcome. It was also a great opportunity to just hear from them what the challenges are.
Decisions about health needs are made in consultation with the local women's committee. The team got their advice on what further help is needed.
And then we visited 2 schools, which was really interesting. The children are absolutely beautiful. All of them are absolutely beautiful. But what strikes you is just how crowded the classrooms are. Like, I think the classrooms we went in had like between 70 and 100 kids in them of all different ages. And, you know, I looked at some of the books that these kids were doing, quite young children, and their handwriting was impeccable. So yeah, it was very, very interesting day.
Going into the school was a bit emotional for me. It was really lovely to see that under the circumstances that we're not used to, children were happy, they were smiling, they seemed eager to learn. When asked about Australia, they all thought they knew where Australia was, and that was really funny. It was nice to see that we could give them some information about Australia and add to their library and give them more tools to use. We got to meet some of the teachers. The challenges, I think, are way beyond what we would expect from what we're used to. Their need was so much more than what we would think. So they needed buildings, they needed benches, books, teachers, and that was something that struck me to say, while so much has been done, so much more needs to be done in the schools.
The following day, the team travelled to Limbo village, where UNHCR is supporting another, smaller health centre. Limbo is 50% refugees. Teachers' Health helped supply a new roof and essential medicines.
Hi, we're standing in front of the Limbo health post with Nurse Dudene, who's the head nurse here. We've just had an inspection of the facility. As you can see, it's got a aluminium roof and mud brick and dirt floors, but inside there is a consult room, delivery suite, together with the post-delivery ward, as it were, with 3 beds with mosquito nets over them. There's a steriliser and there's various drugs. These are the items that Teachers Health has assisted in funding for this community.
Teachers Health staff also donated baby clothes and wraps.
The village of Limbo hosts refugees, and this is open for those refugees and also members of the local community.
The health centre sees 50 mothers and babies a day, but has no electricity, so can't store vital vaccines. Community consultation is key to UNHCR's work in the area. The team talked to the 9 local chiefs to get feedback on the success and further needs of the health centre. Local mothers also spoke about how access to the health centre has transformed their lives.
Ala pensée tu toka yuana ya ci hôpital ti atoka nga inga pareil et façon zone bon kobela so inga ko akomati dimnenga ti tenza pamna inga muti te isa kusala na si na zone gango sala ga popoti na zone sala ganai.
Not the challenges we think that are there. Some of it is so basic, and it would be really good for us to start thinking about how we can extend the support we give them.
I guess what has struck me the most is there's lots of avenues for further assistance here. There's no doubt about that.
So altogether, I was quite amazed. I was on a bit of an emotional roller coaster, But overall, I wouldn't trade this day for the world. It was lovely.